Welcome friends, I'm Dr. Rajsree Nambudripad, and today's video is all about iron deficiency anemia. Did you know that iron deficiency is the most common nutritional deficiency worldwide? A third of the world's population is deficient in iron, and over 1 billion people worldwide have anemia that's caused by the iron deficiency. Iron deficiency affects people of all ages, from infants to seniors, and it affects people of all ethnicities living in every country of the world. Iron is an essential mineral for our bodies, and one of the main symptoms we see in iron deficiency is fatigue. And that's because iron is what carries oxygen in our blood to all of our tissues. This is a picture showing a red blood cell, and within the red blood cell we have a protein called hemoglobin. As you can see, within the hemoglobin, we have iron molecules that bind to oxygen. This is how oxygen that we breathe in through our lungs gets transported to other parts of our body, like our brain, muscles, and heart. In iron deficiency anemia, there are fewer red blood cells to transport the oxygen. This is why people experience fatigue as well as many other symptoms. A lot of the symptoms of iron deficiency become more obvious with exertion, like climbing stairs. Because they have less iron to carry oxygen to their tissues, they may notice dizziness and lightheadedness, shortness of breath, as well as an increased heart rate. Other symptoms of iron deficiency include hair loss, brittle nails with ridges that crack easily, as well as cold intolerance. Being low in iron can also aggravate restless leg syndrome. Because iron is what carries oxygen to the brain, some people with iron deficiency anemia also experience headaches and cognitive impairment. Next, people with iron deficiency can have unusual cravings, and they may want to eat things that are inedible, like ice and dirt. This phenomenon is called pica. Now let's look under the microscope. On the left, we have a normal peripheral smear showing healthy red blood cells. On the right, this is the peripheral smear of someone with iron deficiency anemia. As you can see, the cells are smaller and lighter. Microcytosis is the term for the smaller red blood cells, and hypochromic means they have decreased red color. In addition to carrying oxygen throughout our body, iron is also needed for numerous enzymatic processes throughout our cells. This includes DNA synthesis and regulation of gene expression, thyroid hormone synthesis, and energy generation by our mitochondria. One day, my patient Lauren came to my office feeling really weak. On physical exam, I noticed that Lauren's skin looked quite pale, and when I gently pulled down her lower eyelids, I could tell that she had very pale conjunctival lining below her eyes. In addition, Lauren had an elevated resting heart rate. These are all clues that a person may have iron deficiency anemia. We can find out for sure by doing a blood test. Ferritin is the test that measures our iron stores. The normal range for ferritin is quite broad and can range from 16 to over 200. But to feel better and improve symptoms, you want to get your goal ferritin to over 50. If you're still having symptoms like fatigue or cold intolerance, then you may want to optimize your ferritin to over 100. Unfortunately, iron deficiency is often missed, and that's because most doctors just check the CBC, which is your blood count, but they don't check your ferritin, which is your iron stores. So you can actually have iron deficiency and have a normal blood count far before you develop iron deficiency anemia. Iron deficiency is extremely common, and I see it frequently among my patients who have a normal hemoglobin and red blood cell count, but they have a low ferritin. These patients can still be symptomatic because of the low iron stores, and they may complain of fatigue. Eventually, if not treated, this can progress to iron deficiency anemia, where the hemoglobin and red blood cell count also go down. We also see a low MCV, which is the mean corpuscular volume. This indicates the microcytosis, which is the smaller size of the red blood cells. It's important to be aware that although ferritin is an indicator of your iron stores, it's also an acute phase reactant. This means that any inflammation or infection will raise your ferritin levels. So if you do your blood tests when you're sick or recovering from an illness, your ferritin levels may not accurately reflect your iron stores. So if we suspect that the ferritin level is not accurate, there are other blood tests we can look at to diagnose iron deficiency. This includes low serum iron, high transferrin, high total iron binding capacity, and low transferrin saturation. Now let's go over all the different causes of iron deficiency. First, it could be due to decreased dietary intake, for example, those living in developing countries or those following a vegan or vegetarian diet. Second, it could be due to decreased absorption of iron from the gut. For example, those with celiac disease, inflammatory bowel disease, small intestine bacterial overgrowth, a parasite infection, or an H. pylori infection. Third, it could be due to blood loss, like from menstruation or blood loss through the GI tract or urinary tract. Finally, it could be due to increased iron demands, as seen in pregnancy or lactation, or in infants, children, or adolescents due to the rapid growth spurt. Once again, in developing countries, as well as those living in poverty, decreased iron intake can be a cause of iron deficiency. In addition, those following a vegan or vegetarian diet are also more likely to become iron deficient. Although many plants contain iron, not everyone is able to optimally absorb iron from plants, which we'll talk more about later in this video. The most common cause of iron deficiency that I see among my patient population is blood loss from menstruation. Because of this monthly blood loss, women are often more likely to become iron deficient compared to men. Many women suffer from heavy or extended periods called menorrhagia. It's good to figure out the root cause, whether it's fibroids or high estrogen levels. If you are suffering from heavy periods and would like to learn more about the hormonal imbalance that could be causing this condition, please watch my video on estrogen dominance. Now let's talk about how iron is absorbed through our intestines. Iron is absorbed in the small intestine, specifically in the duodenum and proximal jejunum. You also need stomach acid to facilitate the absorption of iron. People who undergo gastric bypass surgery for weight loss are also at risk for iron deficiency because the surgery bypasses part of the duodenum where iron is normally absorbed. What's fascinating is our body's organs actually talk to each other to coordinate the absorption of iron from our gut as well as the production of red blood cells by our bone marrow. Our kidneys produce a hormone called erythropoietin, and this tells our intestines to absorb more iron, and it tells our bone marrow to increase the production of red blood cells. In contrast, our liver makes a hormone called hepcidin, which blocks iron absorption from our gut. Normally in iron deficiency, hepcidin levels are low. But if there's a lot of inflammation, the liver produces higher levels of hepcidin. For example, obesity is considered an inflammatory state because the excess fat cells produce pro-inflammatory cytokines like interleukin-6. This causes the liver to produce higher levels of hepcidin, which reduces iron absorption from the gut. This is why numerous studies have confirmed that obese individuals have lower iron levels compared to people of normal body weight. Next, if you have any kind of disease process affecting your gut, this can lead to poor absorption of iron. This includes celiac disease, inflammatory bowel disease, parasite infections, small intestine bacterial overgrowth, also known as SIBO, achlorhydria, which is low stomach acid, as well as an H. pylori infection. Extended use of acid-blocking medications like proton pump inhibitors can also interfere with iron absorption. Let's look at celiac disease, for example. This is an autoimmune condition where the body's immune system attacks the lining of the small intestine when exposed to gluten, which is the protein present in wheat products. These tiny finger-like projections are microvilli on the lining of the small intestine. This is how we absorb nutrients from our food. As you can see in celiac disease, the microvilli are blunted due to the autoimmune inflammation, and this can make it harder to absorb nutrients, including iron. Crohn's disease and ulcerative colitis are also autoimmune conditions referred to as inflammatory bowel disease. Ulcerative colitis affects the colon and rectum, and Crohn's disease affects any part of the GI tract. Both conditions may present with symptoms like abdominal cramps and pain, persistent diarrhea, fatigue, weight loss, and GI bleeding. Iron deficiency is common in these conditions because of the impaired iron absorption as well as the GI blood loss. What are some other causes of abdominal pain that's associated with iron deficiency? One possibility is an H. pylori infection, which I'll talk more about in a minute. Non-steroidal anti-inflammatory drugs, known as NSAIDs, can also cause intestinal inflammation as well as bleeding that could cause abdominal pain and iron deficiency. And another possibility is small intestine bacterial overgrowth, which I'll talk more about later in this video. H. pylori is a very unique bacteria that infects the stomach. It's able to survive the harsh acidic environment of the stomach by producing an enzyme called urease, which converts urea into ammonia. Unfortunately, this process neutralizes stomach acid, which makes it harder to absorb iron. H. pylori can also cause gastritis, stomach ulcers, and gastric cancer, which can all cause bleeding and iron loss. To learn more about this fascinating bacteria and natural ways to treat an H. pylori infection, please watch my video on H. pylori. Now let's talk more about gastrointestinal bleeding, which is another big cause of iron deficiency. An upper GI bleed from your stomach causes black stools, whereas a lower GI bleed from your colon causes red stools. GI blood loss could be obvious or occult. Occult blood loss means it's microscopic and the person may not even be aware that it's happening. Obvious causes of blood loss include a stomach ulcer, hemorrhoids, ulcerative colitis, diverticulosis, or bleeding related to the use of aspirin or non-steroidal anti-inflammatory drugs. This includes over-the-counter pain medications like ibuprofen and naproxen. Unfortunately, occult blood loss is sometimes due to cancer, such as stomach or colon cancer. For example, here we have my patient Jeremy, who was taking a lot of ibuprofen for his knee pain. A week later, he started to notice black stools and felt very tired. His blood work showed that he was now anemic with a hemoglobin of 10.2, and his ferritin, which reflects his iron stores, was now really low at 12. Unfortunately, Jeremy probably got a stomach ulcer from taking all the ibuprofen, which was causing his black stools. Anytime there's a suspicion for GI blood loss, it's helpful to do an endoscopy and colonoscopy to identify and treat the source of bleeding. Here we have my patient Jackson, who has been struggling with symptoms of irritable bowel syndrome. He underwent an endoscopy and colonoscopy, but they both came back normal. That's because there is something that you can't see on these procedures, but it happens to be a big root cause of irritable bowel syndrome and can contribute to iron deficiency. I'm talking about small intestine bacterial overgrowth, also known as SIBO. In SIBO, bacteria from your colon move up into your small intestine where they're not supposed to be, and they can cause a lot of gas and bloating after meals, as well as interfere with the absorption of iron and other key nutrients. I have 2 videos that can help you learn more about SIBO. The first reviews the condition in detail, and the second explains my herbal protocol to help you overcome SIBO. Treating your SIBO can help improve your symptoms and improve your absorption of iron. Now you might be wondering, what foods are the best sources of iron? Let's go over the difference between heme iron and non-heme iron. Heme iron comes from the hemoglobin and myoglobin proteins that are present in meat, poultry, and seafood. In contrast, non-heme iron comes from plant sources, so it's found in green leafy vegetables like spinach and chard, whole grains and legumes, as well as lentils. Certain vegetables like beets and certain fruits like dates are also a good source of non-heme iron. Now there is a big difference in how easily heme iron gets absorbed compared to non-heme iron. We call this the bioavailability of the iron. Heme iron is absorbed more easily, with about a 15 to 35% absorption rate. In contrast, Non-heme iron is not absorbed as well and only has about a 2 to 10% absorption rate. The absorption of non-heme iron is also influenced by a lot of factors that are present in plants, which I'm going to explain in a few minutes. Red meat and liver are the richest sources of heme iron that have the highest bioavailability. If you do eat meat, it's important to choose organic or grass-fed whenever possible. Did you know that if you cook with a cast iron pan, it can help to add small amounts of iron to your food? Egg yolks also contain iron. Now let's review the facilitators and inhibitors of iron absorption. Vitamin C is a key facilitator of iron absorption along with stomach acid. Inhibitors for iron absorption include phytates, oxalates, calcium, as well as polyphenols called tannins. Unfortunately, a lot of these inhibitors are found in plant foods. For example, dark leafy green vegetables have oxalates as well as calcium. Tannins are found in tea. Legumes and whole grains contain phytates, which are also known as anti-nutrients because they inhibit the absorption of other nutrients like iron. Now let's talk about the power of vitamin C. Vitamin C is a potent facilitator of iron absorption, and it's found in foods like berries, citrus fruits like lemons, limes, and oranges, pineapple, as well as vegetables like broccoli and bell peppers. The good news is that vitamin C can help to overcome some of the inhibitors that are found in plant foods. So it's helpful to incorporate more vitamin C-rich foods to enhance your iron absorption. It's also good to be aware of other iron inhibitors, like calcium supplements, or extended use of acid-blocking medications like proton pump inhibitors. Now that you understand the foods that are rich in iron, you can see why a tea and toast diet could put you at risk for iron deficiency. Tea contains the polyphenol known as tannins, which inhibits iron absorption. When it comes to standard iron supplements, many people encounter side effects, which include constipation, nausea, abdominal pain, and black stools. That's why in my practice, the preferred form of iron that I recommend to patients is ferrous bisglycinate. Research studies have shown that ferrous bisglycinate has less gastrointestinal side effects and is more effective at raising hemoglobin and ferritin levels compared to other iron supplements. I always have patients take their iron along with vitamin C, which is ascorbic acid at least 500 milligrams, because this can really help facilitate the absorption of iron. I also recommend taking these after food so that it's easier on the gut. Another option for iron supplementation that's well tolerated is desiccated liver pills. These are often made from animal liver, such as grass-fed beef liver. Although desiccated liver is well tolerated because it's a food source of iron, the impact on ferritin is often very gradual. Iron supplements can interfere with the absorption of thyroid medication, and calcium supplements can interfere with the absorption of iron. So it's important to have these taken at least 4 hours apart. So you can take your thyroid medication first thing in the morning on an empty stomach, your iron and vitamin C after lunch, and your calcium after dinner. Another way to improve your iron levels is with an intravenous iron infusion. The benefit of IV iron is that it bypasses the gut. So this can be a great option for those who struggle taking oral iron supplements or those who have gut issues like inflammatory bowel disease. For some patients, this can be a great way to get their ferritin over 100 more quickly. Now, if a person has severe iron deficiency anemia and their hemoglobin drops below 8, then they should be rushed to the hospital for a possible blood transfusion. My patient Lauren from earlier in this video had her blood work done, which revealed that her hemoglobin was critically low at 7.2 with a ferritin of 5. When your hemoglobin falls below 8, this makes it hard for your critical organs like your brain and your heart to get enough oxygen. Fortunately, Lauren was able to get a blood transfusion to help her feel better. Later, when Lauren was stable and released from the hospital, we were able to address the root cause of her anemia, which was really heavy periods caused by fibroids. Now let's shift gears and talk about how the gut microbiome can affect iron absorption. Did you know there's a specific strain of probiotic called Lactobacillus plantarum that in research studies has been shown to significantly improve iron absorption? The good news is we carry 3 different broad-spectrum probiotics that all contain Lactobacillus plantarum. This includes our probiotic 100 billion, our probiotic 225 billion, as well as our probiotic 20 billion with Saccharomyces boulardii. Now, what else can you do to help your gut to better absorb iron from your food? If you're noticing any symptoms of indigestion, like gas, bloating, or belching after meals, it can be helpful to supplement with strong digestive enzymes, like our Digestive Enzyme Pro. If you suffer from low stomach acid, supplementing with betaine and pepsin can also help facilitate the absorption of iron. Now that we've established how important iron is for our health, it's also good to be aware that too much iron can cause oxidative stress. Similar to the process of rusting, unbound iron can overload in tissues and generate reactive oxygen species and free radicals. This is another reason why it's helpful to take vitamin C with your iron, because vitamin C is a protective antioxidant. When it comes to choosing a multivitamin, how do you know if you need the one that contains iron? Typically, menstruating women need a multivitamin with iron because they're losing blood every month. In contrast, men, as well as women who are in menopause, are often fine with a multivitamin without iron. If you are supplementing with iron, it's a good idea to monitor your blood work at least every 6 months so that we can keep an eye on your ferritin levels. Now let me introduce you to one of my patients named Layla, who is a 34-year-old woman who was suffering from significant fatigue. Layla had been on a vegan diet for years, and when I checked her blood work, it showed iron deficiency anemia with a hemoglobin of 10.2 and a ferritin of 5. Unfortunately, Layla was not absorbing enough iron from her diet to keep up with the menstrual blood losses every month. So I started Layla on iron bisglycinate along with vitamin C, which she tolerated very well. I also had her take Digestive Enzyme Pro with her meals and probiotic 100 billion once a day to help improve her absorption of iron from her food. I monitored Layla's blood work every 3 months, and at 6 months, her hemoglobin had normalized to 12.7 and her ferritin had improved to 52. Best of all, Layla felt so much more energy, and she was able to resume her passion of teaching dance classes. Let's review the key points from today's video. Iron is an essential mineral that carries oxygen throughout our cells. Common causes of iron deficiency include inadequate intake or absorption, as well as menstrual or gastrointestinal blood loss. Heme iron is better absorbed than non-heme iron. Vitamin C is a cofactor that facilitates iron absorption. Having enough stomach acid also enhances iron absorption. Finally, having a healthy gut microbiome is essential to optimally absorbing iron from your diet. And the probiotic species Lactobacillus plantarum has been shown to significantly improve iron absorption. Thanks so much for watching this video. If you enjoyed it, please give it a thumbs up and subscribe to my channel. Please post all your questions and comments below. I really look forward to hearing from you. Thank you again, and have a wonderful day.